What you're going to see during this series are people that are trying to get healthy, but don't know where to start, don't know what levers to tweak. And so you're going to see us do our evaluation, go through the processes, figure out what's their purpose, what's their why, where are they at when it comes to the nutrition and exercise, stress management, and connection. And it's going to be relatable. Like there's so many people out there that are going to be saying, "That's me," or "That's my mom," or "That's my brother, sister, my spouse, that's my son, my daughter." And if they could point towards this series and look at an episode and say like, "Hey, did you see what they did to increase that protein intake? You see they start to introduce some intermittent fasting and seem to really be working." That will be a motivator. I want people to, at the end of the day, to feel like they have the agency, they have the ability to take control of their own health. Because this is why I'm passionate about this. Because I've seen too many people that say, "Oh, this is my genetics. Oh, it's my this and that." And I'm here to tell you, yes, genetics can be an uphill battle for some folks, but you have the control. You have the ability to reverse your metabolic syndrome. You have that ability to improve your mental health. You have that ability to be connected. So let's do this together, Like you're gonna watch it and you're gonna be motivated and you're gonna be like, "Man, I want to work with Dr. K." My name is Dr. Kwadwo Karamantang. I'm an ICU physician, also specialized in palliative care, and I'm the host of Prevention Over Prescription. I grew up in Edmonton, knew from an early age I wanted to be a physician. I had the most amazing pediatrician as a kid. I had bad childhood asthma, and Dr. Conradi, when he walked in the room, when we couldn't breathe, when mom and myself were scared, he would put your hand on your chest, put his hand on mom's arm, and just settle us down, and just had that compassion and had that ability to create some peace and security. And I grew up thinking like, this is what I want to do: take away suffering, eliminate that, and be that for my patients or for society. And I wasn't sure where in medicine I would fit, but I ended up doing a rotation at the intensive care unit in Calgary. And it was clear to me this is my home. I loved it. It was a fast pace. We worked as a team. You didn't know what was coming through the door. You had to be on your toes. And so to me, this was so exciting. This is my home. This is what I knew I wanted to be, an intensivist. And at the same time, I started to see so many inefficiencies in the healthcare system. So I wanted to be this intensive care doctor. Came to Ottawa, did all this training. But one thing that was very clear to me was how inefficient our healthcare system was. We were wasting money and not getting results. And long story short, I built a research platform, a research program where we called ourselves a resource optimization network, multidisciplinary team, looking at ways that we could improve healthcare and at the same time save healthcare dollars. And we were successful. We had over 100 papers. We were publishing in high quality journals. But I'll tell you, nothing was happening. Nothing was changing. And to me, this was a big marker. You want to have impact. And so we pivoted. We started a podcast to try and get the word out and focusing on areas like mental health, virtual care, all these areas within healthcare that seem to be show some promise in terms of being difference makers. And then the pandemic happened. The March 2020, when everything changed. It was a scary time as an intensive care doc. As you can imagine, we didn't know if we were going to be the next Italy. We didn't know if we were going to be the next New York City. it was scary. You didn't know if you're bringing COVID back to your family. You didn't know if you were going to get sick. You didn't know if we were going to die, like we were seeing on the news. And luckily, we found a way to pull through. We realized we could protect ourselves. We didn't bring COVID back to our families, but seeing patients and families have to suffer in that way, it was awful. And to me, you want to do everything in your power to help our patients. And this is before vaccines. And one thing that was abundantly clear, especially early in the pandemic, my patients predominantly had metabolic syndrome. And what's metabolic syndrome, you ask? It is the constellation of obesity, type 2 diabetes, high cholesterol, high blood pressure. Patients that unfortunately weren't healthy. And through the work of the show, through the work of our podcast, I slowly came to the realization. Someone pointed me towards Jason Fong. He's a nephrologist, medicine doctor in Toronto, and he had this idea, he brought to attention the power of fasting, intermittent fasting, and through his work, he was reversing people's metabolic syndrome. He was reversing people's type 2 diabetes. I was like, what is this? I didn't learn about this in medical school. I've never heard of this. And I'm almost embarrassed to say this. And so when I learned that you can reverse people's medical conditions this way, I was like, I'm all in. This makes too much sense. We need to try and provide our population with ways to get healthy. Prevention over prescription. That's where it birthed. This is where it came to life. Because when I thought about this, I'm a resource optimization network, and we do our research on how to save healthcare dollars and all these things. I'll tell you, when you land in ICU, for example, land in ICU because of COVID, that was a $53,000 admission. Plus, you're away from your family. Plus, you might not survive. Plus, if you do survive, you are a shell of the person you were. You have chronic conditions, chronic lung disease. Plus, your ability for your family to be functional. They have to take care of you. They take time away from work. The huge impact an ICU hospitalization has. So why don't we put all our eggs into preventing you from landing in ICU? Prevent the suffering, prevent the PTSD and the mental health disturbances that are associated with the admission. Let's avoid you from seeing someone like me in the ICU. That's the juice. That's my mission. That's what drives me. That's why we're talking here today. And why I'm so passionate about it too is because it doesn't have to be as complicated as we think it has to be. This is why we produce the book. This is why we're on here to keep it as simple for folks, because honestly, you just need one or two changes in your life. One or two changes in your life that could make a huge difference and completely change the trajectory of your health, completely change the trajectory of your family, because when they see you getting fit, when they see you eating better, it's contagious. So this is the mission. This is why I'm here. This is why we're talking today. This is why you're seeing my face everywhere, because we are going to create that change. We're going to create that movement, yo. It starts today. When I help, when I'm involved in somebody's care, you're affecting one life at a time. And obviously it's super rewarding when things go well. But what I came to realize slowly was that the work that we're doing, whether it's through social, whether it's through the book, the podcast, you could reach so many more people. Like, one of my favorite moments these days is I love it when someone comes to me and they say, Quadro, I gotta tell you about my brother. He was a pre-diabetic or diabetic. He's on 2 medications for his diabetes. Heard your podcast on fasting. Start to introduce that into his life, and now he is off his diabetic medication. Now he's down 20 pounds. Like when I hear that, man, is that ever like this? That gives me so much juice, because it's like you realize you have completely changed the trajectory of this person's life. They were going on that path of being pre-diabetes, diabetes, ending up in acute care or in the ICU eventually, whether it's a heart attack, stroke, cancer, mental health, right? And now, because of your message, because of getting through to people, now it's completely changed, and the people around them are now going to get healthy. To me, this is so. There's nothing that means more when it comes to the advocacy right now, and not from this. Another. Well, actually, all the stories are similar. And one other story I think is worth highlighting too. This wasn't directly. I wasn't directly involved in this, but I had a patient that was in his mid-70s. He unfortunately had a cardiac arrest, so he died for a period of time. And his wife, luckily, was a nurse, retired nurse, and resuscitated him. And typically when this happens, when you're in your 70s and you have a cardiac arrest, the outcomes are awful. You either die, or you're in a long-term care facility, or you never leave hospital. That's the typical scenario. But what made this gentleman unique is that he hit the gym 5 days a week. He, for lack of a better word, had body armor, resilience. He had the ability to overcome so many medical obstacles because he was strong. Like, people don't realize this as an ICU in 2025, but it's actually hard to die. It's hard to die because the machines work to support your lungs, to support your heart, to support your kidneys. But what it comes down to is quality of life and how strong you could be. Can you avoid being frail? And because this guy hit the gym 5 days a week, he was, and no word of a lie, he was able to walk on a ventilator while on life support in his 70s. Like, unbelievable. And not only does the power of being strong, like, obviously it helped him in terms of his recovery physically, but mentally, because there's going to be mornings where he didn't feel like going to the gym. Same with mornings when he was in the ICU, he didn't feel like working with a physiotherapist. But he did it because he had that resilience muscle. He knows that he can do it despite not feeling like doing it. And because of that, he's home today. And that's the power of being strong. This is why I push to anybody that listens. Strength is medicine. It is vital. Frailty is a killer. And so I motivate everybody. I say, anyone that's willing to listen, push that weight. I don't care if you're doing body weight exercises. I don't care if you're using bands. If you do get to the gym, that's a plus. But let's get strong. Collectively get strong. It is medicine. It is an antidote to getting sick and landing in an intensive care unit. So that was another story that came to mind in terms of why we talk about the things we do. I remember specifically when I there were a couple of times where I really thought to myself, we need to pivot in our focus. And there was a time during the pandemic where it was probably one of our busiest times, and I was sitting there with 4 a.m. with a respiratory therapist. We're looking at a patient, deciding whether we intubate that patient. And the reason it was a stressful decision is because at that time, if you said you're going to intubate a patient, they're going to be on a respirator for at least 3 weeks. You know they're going to be away from their family. Only a third of them survived. So it was a big decision. And when bringing up and discussing with the respiratory therapist, she actually got emotional. She started to cry when we were talking about this. It's like, this is just too heavy. Like, it's just, I'm sick of seeing our patients suffer. I'm sick of seeing them being away from their families. And I say to myself, damn straight, you're right. Like, we shouldn't, people shouldn't have to go through this if we could, people shouldn't have to go through this, especially if we have the means to avoid it. And I think, to me at that time, it was like, this is not only affecting the patient, the family, it's affecting the healthcare system. It's affecting all of us. So let's lean into this. And we don't have enough champions that are talking about this, about preventative health, about how you eat, how you move, finding purpose, how you reduce your stress, how you connect with others. It's a simple formula, and it has a huge impact, but it's not sexy. It's not as sexy as Ozempic. It's not as sexy as whatever GLP-1 du jour, but it's impactful. And if we make it culture to learn about these things and really embrace our health, our futures will look bright. That's my favorite. And we're talking about Coach Emma just a second ago, and she got me making sure I got the proper technique. But this is whole body exercise again, posterior chain. So let me just tell you this. I'm not young. I'm very middle-aged, and it's not easy. But one thing that I need to say is, or that is important to me, is to live the life that you're really encouraging. Be the change. This is what I want to see. So in my house, I got 3 boys, got a beautiful wife, and taking your health and your mental health, your physical health seriously is paramount. And we wanted to show it for our boys. So we work out together. We eat well together. We focus on protein. The boys will say, like, Dad, you see how much protein's on this plate? What's up now? Like, this is the existence that we try and provide, because we want to be the example. So what's a day in my life? I'll tell you this, for me, I always prioritize some form of exercise. I try and say I do some level of exercise daily. And it doesn't have to be tremendous. It could be just going out for a brisk walk with the dog. It could be doing a 5-minute Tabata workout. You know, I'll give an example. When we're recording this today, all right, I was on call last night, slept maybe about 5 hours, and it was broken up by a couple calls. And I knew we might not have that much time to work out today. So I grabbed the dog, we go to the park, I let her go, and I do some sprints. Good girl. What are we gonna do? What are we gonna do? Yeah, acting like you're the tough person. You saw David earlier. So yeah, Coco, our 3-year-old puppy. I like taking her out on walks. That way I make sure I get my step count in for real. Best to do it especially after a meal too, right guys? Like, you're gonna kill 2 birds. Watch out, you're gonna burn your calories post meal. Get some your step count in. You're gonna sleep better when you do that too. Right, Coco? That's what I'm talking about. Yeah. Grab the dog, go outside, let her off leash. I do my sprints. Took me 10 minutes. And yeah, is it what I like to do more during a day? Of course. But this is who I am, is prioritizing exercise. And so this is as an example of where we squeeze it in. And so in terms of nutrition, I'm a big fan of intermittent fasting. I've been doing it for the last 6+ years. I like it because of the freedom it gives. I just get up and go in the morning. And then my 2 meals, I demolish as much food as I want, is in terms of high quality food and protein focused, whole food focused, demolish as much as I want. I don't think about my quantity. And having that freedom for me has been amazing. So yeah, the day in the life would be usually try and squeeze in exercise first thing in the morning. I which I love. For me, it's important to have resistance training involved. Obviously, the days at work can be long, and so getting home as quickly as I can, connecting with the family, getting out and getting my step count as much as possible. So going out playing with the kids, walking the dog after a meal, but and then trying to get to bed. I should get to bed earlier, but I end up probably lights out probably around 11:30. But really trying to focus on the quality of sleep I'm getting to make sure it's the best quality possible. But yeah, about a typical day. So we developed what we call the PRESS method, and it's based on 5 principles. So finding your purpose, really connecting with your why is the P. R for recovery. So sleep as the primary source of recovery and stress management. And so we talk about ways that we can reduce stress in your life. E is for eating, your nutrition side. Are you getting enough protein? Are you reducing your processed foods? S is for strength. We all know the importance of resistance training, but also making sure you're moving enough during the day, getting that step count out. That's going to help with your sleep. It's going to help with your mental health. What's going to help with your overall longevity. And the last S is social connection. Are you connecting with others? Are you reaching out to your loved ones, making sure that you have that level of connection in your life? And one of the scoring systems we have is you just rate yourself out of 5 in each of those categories. And if you're less than 15, there's probably some work that we could be doing to try and optimize that. And so we're looking at those pillars. We kind of look at what's going to be the most bang for your buck approach. What's going to give you that 80-20 to give you the best benefit? So for example, if you are 20 pounds overweight and we look at your diet and you're not getting enough protein in, how do we introduce more protein into your day? How do we introduce, whether you're animal-based, whether you're plant-based, where do we squeeze it in during the day? What snack items can you have that would be a great replacement that kind of focuses on protein? Little things, little tweaks that we can make that can make a huge difference in your life. I mean, certainly we want to get the word out there on ways to live healthy as much as we can. So we're very active on social media. We have a good healthy following on TikTok and Instagram, LinkedIn, YouTube, Facebook. We have our podcast, which has been a great source and great learning for me. Prevention over prescription. It was formerly known as Solvent Healthcare. That's been great. We started a supplement line. As you could tell, I am very serious about protein intake. And so when we had the chance to work with a local company to produce Canadian manufactured, high quality, MD backed, Health Canada approved protein powder, I was like, let's go. And so we started Guided Nutrition for that reason. Simple way for people to really amp up their protein intake. And so to me, this was a no-brainer. So this has been another passion project. And then of course we wrote this book, Prevention over Prescription, baby. And this has been such a great experience to really put the thought to paper in terms of how we could distill things as simple as possible, give worksheets at the end to make sure that people go through their 5 pillars and we walk them through. And what I love and most proud of about the book is that we really did keep it simple. We really did make it feel like your goals in terms of getting healthy can be attainable. And that was one of the main objectives. And just want to give a quick shout out to all the support, Lucky Book Publishing, my wife Kathy that let me take time to write this book, my boys, who else? All the Sarahs in my life, my admins that have give me a little bit of space, my staff. Like, it's been an amazing journey, and honestly, I think it's been life changing to be able to put this together. This is Dr. K here for Prevention over Prescription, and we are doing this today because I don't want to see you in the ICU.